not going to delay this so much. I just want to tell you that this evening we are very, very privileged. We are having a presentation this evening from Dr. Mary Twagira, who is a consultant microbiologist with Croydon NHS Trust. So this information about vaccines and vaccination is something that she knows so much about. And we will also have our very own Catherine Cargill Sebuchima, who is a healthcare worker and vaccinator in Croydon University Hospital. So I would like to welcome you both, and I would like to hand over to you right now.
Thank you very much for inviting me. As you've said, I am, my full name is Dr. Mary Francis Namatov Twagira. Diagnosing infections, treating infections, preventing infections. And so that includes vaccinations to prevent infections. So I'm talking about the COVID vaccine. At the moment, currently there are 3 vaccines that have been licensed here in the UK. There is the Pfizer one, there is the Oxford one, and then there is the third one, which is Moderna. And I hope to talk about, firstly, how vaccines work, the old vaccines, how they are made and what they do, and then the new vaccines. So vaccines stimulate our immune system, and they try to make the body get antibodies that will target the bug, whichever organism we are trying to prevent. So in this case, we are trying to prevent COVID-19. So we are talking about that. The traditional vaccines are usually made by, one, they can be made by killing the organism. For example, you can get a virus and you kill it. You need to grow it and kill it. And then that killed virus is used to vaccinate people. Others, they just get bits of the virus or the bacteria and use part of that to vaccinate people. There are others like the polio vaccine and the chickenpox vaccine. Those are live viruses. They are live, but they've been made weak. They can't cause disease, but they will prevent infection. And then you have a virus like the Ebola vaccine. It's just part of the vaccine, the virus that is put into another less harmful virus, and then that other virus is injected into people. So the next slide, please. This is the picture of the coronavirus that causes COVID. And I don't want to make it very, very too complicated, but if you look at RNA, that's where we are going to focus mainly. RNA, that is the genetic code of the virus. And that genetic code then codes for different proteins. As you can see, there is the spike. You've heard about the spike protein. There is the membrane protein. There is the envelope protein and a lipid membrane. The most important protein is the spike protein. The virus uses that spike, it attaches to the cells, and then goes inside. So in order to make a vaccine that will prevent the virus getting into the cells, most of the companies have focused on the spike protein. So if they can make an antibody to attack the spike protein, then that's what they would do. And at the moment, there are over 140 vaccines under development. But so far, as we've seen, there are 3 currently used. In future, we will get more and more vaccines against this coronavirus. The next slide, please. So the 3 vaccines, as I've said, there's the Pfizer, AstraZeneca, and Moderna. And all these 3 vaccines are what we call RNA vaccines. M is for messenger RNA. So as you've seen in the picture, for the whole virus to be complete, you need the whole RNA. But what they've done here, the manufacturers have gone and they've found a section of that RNA, just a section, not the whole RNA, but a section. And they've cut that out. They've mass produced it in the factory. And then they've put it into different carrier molecules. And they inject that. They don't inject the virus. They inject part of the RNA, just part of the RNA. And what happens is when it reaches the cell, in the body, it produces antibodies against the spike protein. So anytime now when you face the virus, you have antibodies to protect you against the COVID, because you are producing antibodies against the spike protein. The only difference between these viruses, the Pfizer virus is slightly different from AstraZeneca and Moderna. And the Pfizer and Moderna, sorry, there is a mistake there. Pfizer and Moderna are similar. AstraZeneca is slightly different. The reason being that AstraZeneca, remember when I said the Ebola vaccine, so AstraZeneca, what they've done is they've got part of the RNA, they've put it into another virus, a harmless virus called adenovirus. And that enables it to get into the cells. They inject that and it gets into the cells. Whereas the Pfizer and the Moderna, it's just a lipid molecule that has been used to carry the RNA into the cells. Next. So I think this is slightly a bit detailed, but as I've mentioned, part of the RNA code, it's not the whole virus, it's not the whole RNA, it's just a section of the RNA. It's injected and is taken up by our immune system. Our immune system produces spike protein, which goes outside and goes into the lymph nodes and so on and so forth. And then the lymph nodes are able to produce antibodies. The advantage of these vaccines is that it's not only the antibodies that are triggered, but also other cells. So the immune response is much, much stronger than some other vaccines. So if you are exposed to the live virus, the antibodies attack the virus and they prevent you from, really, it's not preventing the infection, it's preventing severe infection. And the same again, as I've mentioned, AstraZeneca, there is that adenovirus that is used to carry the RNA into the cells. Okay, so all vaccines have some kind of side effects. The commonest ones for the current vaccines, as you can see on the left, the injection site where you get it, most people have painful injection site. Some people will feel very, very tired after the injection. Many people get headaches. However, the other side effects are not as common. So you have body aches, joint pains, chills, and fevers. These side effects should not last more than a week. they usually go away within a day or two. There are some very rare side effects which they've reported, like the facial droop. You've heard about people reacting to the vaccine, anaphylaxis, swelling of the body, and so on. But those are very, very rare. And at the moment, what the advice is, when you get the vaccine, you should wait for at least 15 minutes after you've been vaccinated, just in case someone develops any severe side effects. I'm sure Catherine will talk you through what they actually do, but overall, it's quite safe. They are quite safe. Next slide, please. There've been concerns from people saying, how come we've had this COVID for 1 year and already we have a vaccine? How come the vaccine has been made within a very, very short time? But actually, the technology has been going on for more than 20 years. I don't know whether all of you remember SARS. There was a SARS pandemic in 2003. And there is also there's another virus called MERS, which is mainly in Dubai, United Arab Emirates. And all these, they've been trying to find a vaccine, an RNA vaccine that can work on these. So when this COVID pandemic started, there were so many resources available, so many people put their knowledge together to come up with this vaccine. They are very, very much easier and cheaper to produce. Remember, the other vaccines are usually, you have to grow the virus, you have to purify the virus. Here, once they got the code, they produce the codes, the extra codes in a factory. So it's very easy to produce, it's cheaper, and it stimulates both antibodies and the immune system. And that has enabled us to be able to have a vaccine during this COVID. Usually vaccines take years to develop, but because of what has been around already, we've managed to have this vaccine. Next slide, please. So that is a summary of what I've spoken about. Currently, the Department of Health is very, very open. So what in the NHS, we have what we call the yellow card system. So if anybody gets any side effects of any medication, you can report it. If you type in yellow card, you can report it to the Department of Health. And so they've already started collecting that information about side effects. And really the side effects I've mentioned before are the ones that are still current vaccines and any other vaccines as well as COVID. I'm happy to take any questions, comments.
Okay, thank you so much, Dr. Mary.
Janet, thank you very much, Church in Thornton, Heath. It's an honor for me to be here to speak to you and share my experience. My name is Catherine Cargill, as you've been told, and I work at Croydon University Hospital as a healthcare assistant in maternity. And also since December, I've been working in the COVID vaccination hub, vaccinating people. So my journey is to tell you that I received the vaccine at the beginning of December. I think it was the second day we're vaccinating at Croydon that I had my vaccine. And then at the end of December, I got my second dose before the government changed when you'd get your second dose. For my first dose, apart from the pain in the arm, I didn't have any other side effects. I had my vaccine in the morning and I was able to carry on my work with no other problems. The second dose, I had a more painful arm for a couple of days, but apart from that, I didn't have any other side effects. But like Dr. Mary said, some people have experienced the other side effects that have been mentioned. but we all know that we all react differently to drugs. You know, some people can't take paracetamol, for example, ibuprofen, or some people, even when they get their flu jab, some people fall ill, some people don't. So I was conscious of that. In my role at the hospital, I vaccinate pregnant women with the whooping cough vaccine and also the flu vaccine. So I was aware of how the vaccines work in our body, and all my children have been vaccinated. I do believe in vaccines because I see what they can prevent. So last year, like all of you, when we were faced with this pandemic, we're all scared, we're all worried. And we were all praying really for a solution, because, you know, I remember doing that, and I'm speaking to many of you as Christians. So when we had the restrictions as part of a solution to try and stop the spread, we did that. When mask wearing came in to try and prevent, you know, infections, we did that. Hand washing, physical distance, those were all the things we did at the beginning. But all of you, you saw the numbers were still going up in spite, you know, of people trying to do whatever they did. We had our concoctions of garlic, lemon, ginger, you know, we were all doing what we can. So when they started talking about the vaccine, I was personally excited, because I know the way the vaccines work. Now, when the vaccine came much earlier than I thought, or that I was praying for, I was also skeptical at the beginning. I was like, oh, vaccines normally take a long time. How come this one, they're telling us we'll have it by the end of the year? In fact, I didn't even believe it would be ready by the end of the year, because previously vaccines do take a long time. But anyway, the vaccine did come. So then I did my own research, you know, to find out about how this vaccine has been produced, find out the side effects of the vaccine as well. And after all, and talking to other people as well, Dr. Mary is very helpful. We always call her when we're not so sure. If we come across an infection, she will give us good information. So I talked to the people that I trusted, you know, people that I knew were experts in that field, you know, in spite of all the horrors that were coming about, in spite of all the fears from our community, which are valid fears about the vaccine, you know, I still did more research as well. So when the time came in December and we had, beg your pardon, when the vaccine, sorry about that, should have switched my phone off. When the vaccine came, I was ready to have the vaccine, and I went ahead and had the vaccine. So I had a few reasons why I had the vaccine. First of all, I work in healthcare and I'm on frontline. And I was worried to take the coronavirus back home in case I caught it, because I was in frontline. And at the beginning, we didn't have much PPE, as you all remember. So those were some of my thoughts about having the vaccine. The other vaccine was also, I had seen people who had been very ill with the virus, people who had died. So then my second reason was to take the vaccine to protect my own self. I did not want to get ill. I definitely did not want to die as yet, because I've got my children. But I was thinking that if there's something I can do to prevent myself from getting ill, then I'll do it. I was wearing my mask, I was hand washing, I was keeping physical distance as much as possible. So for me, the vaccine was a fourth thing in that line of protecting myself and protecting my family. Also, being on the front line, I did not want to unknowingly pass that virus on to the women that I work with. I work with pregnant women and with babies. So I was very conscious to make sure that I did not pass that virus on, because we all know that some people can have the virus with no symptoms. They're not feeling ill at all. So I did that to protect myself. And also when the second lockdown was announced, I was very, very disappointed. I did not want to go into a second lockdown. So I was thinking, okay, if getting the vaccine is one way to help us get out of this pandemic, or to try and manage the spread of the infection, to try and manage people who are getting very ill, lots of people were dying. That was another reason why I also took the vaccine, because I wanted us to go back to some sort of normality. And if that was going to help, I'd done all the other things, but as you all know, the infections were still going up, the deaths were still going up. So I took the vaccine. And of course, people were worried about, the vaccine being made against Black people or Asian people as well. So again, I did some research to see if the vaccine had been tried and tested of people of Black people and Asians. So the 44,000 people who did the first trials, I think about 9% were Black people. So I knew that the vaccine had been tried on Black people as well. So that sort of gave me some confidence as well. And, it had been passed as being effective and safe for Black people to take. So that was another reason. Those were all the things that I was using to decide whether or not to take the vaccine. So that also encouraged me to take the vaccine. And I also thought that the 44,000 people, in a way, they had put their lives on the line, because when they signed up for that trial, they didn't know what the side effects would be. No one else had taken that virus. So then I thought, well, they've done the first bet. I'm willing to then do the second bet of taking the vaccine and see what happens. So at the moment, since taking my vaccine, every 2 weeks, I go to St. George's, I do a COVID swab, and also they take my bloods, because they still want to find out how long do the antibodies stay in your system, and also can you catch the virus after being vaccinated, because getting the vaccine was a first step in a long journey. Like Dr. Mary said, there's so many other vaccines being tried, and we still don't know how long the antibodies stay in the system. But for sure, they have said that it is a good protection to prevent severe illness. And that's what we want to prevent. So the trials and the testing is still going on. But meanwhile, what I want to encourage people is to think very, very personally of your own situation. If you're working in frontline, if you are working in a care home, if you're a nurse, doctor, you're in healthcare, you're a social worker, if you're facing the public every day, you work in a supermarket, you're a teacher, you care for somebody at home who's vulnerable, maybe older people, or if you have children who are ill, you should really think about getting the vaccine to protect yourself and to protect your family. Because the last thing you would want is you catching the virus, spreading it to your family. Maybe you don't know, but also you getting ill. The people who've got ill and managed to overcome the vaccine, many of them have said that the side effects take a much, much longer time, So that's why I've come here to share with you my journey, in that I've taken the vaccine. I've had no side effects. I've continued to work throughout. When we had the pandemic, I thank God I did not catch the vaccine, the virus at the beginning. Since I've had the vaccine, I've not been ill, that I can't, you hear all these stories that if you get the vaccine, you're going to be ill. That has not happened to me. So I'm bearing witness in that since having the vaccine, I've been well. I get a test every 2 weeks at the hospital. I've not caught the virus as yet. Thank you very much. Back to you, Janet.
We thank you so much. Thank you so much, Catherine. That was very encouraging. Some good information and good testimony for all of us. Thank you, Dr. Mary, as well. So at this time, what I'm going to do is to invite everybody on the call today. If you have a question, how it's going to work is you raise your hand or write it in the chat room, and we will direct it to one of our experts to give us an answer. Okay, so we already have a question. I think how we're going to do this is I'll take about 3 questions at a time, and then we get those answered and we take the next lot of questions. So if you start showing your hands, can I be the first one as I wait for questions to come in? My question is, so Dr. Mary told us about the 3 different vaccines that are available and being used right now, the Pfizer vaccine, AstraZeneca, and Moderna. And she did say that Pfizer is the same as Moderna, but AstraZeneca has a different way it was made. Which of the 2 is the best to take? And do they work any differently, or any of them more riskier to use? That will be answered later. I've got a question in the chat room here coming from Joyce. And Joyce is asking, are all people getting the vaccine being followed up? That's a question.
Can I answer that, Janet?
Yeah, I was going to take 3 questions at a time, and then we get them answered so that we can save up on time. Okay. And we have another question from Reverend James. Reverend James is asking, does the small strip of the RNA in the vaccine affect an individual's DNA? The small strip in the RNA in the vaccine. So Margaret is asking if you'll be able to share the slides with us, and I guess we can talk to, or you can let us know as you answer the 3 questions. So please take that away. There is your 3 questions as we get more.
Thank you. Dr. Mary, I'll go fast if that's okay. Are the people getting the vaccine being followed up? I should have mentioned that. So when you come into the hub, let's say you've got a letter from your GP, or if you work as frontline, you can book either through your work or you can...
Not in the DNA. It's the ribosomes that handle that RNA, and then they use it to produce the spike protein. And after a while, actually, that RNA completely disintegrates and is not in the system. So it doesn't remain long. It's just there to switch on producing the spike protein, but it doesn't go into the DNA, into our DNA. After a while, you won't find it.
Thank you, Dr. Mary. There was a question also about which vaccine is better than the other.
Well, the literature, Pfizer says it's about 95% effective. The AstraZeneca is slightly lower, but as we've mentioned, there are so many people who need the vaccine. There are not enough vaccines to sort of go around. That's why they've prioritized certain age groups. So whichever one, if you get any of them, they've been licensed. Whichever one you get, it's better than nothing. But the efficacy is very high. I don't know whether, Catherine, you want to add to that?
No, that's what I was going to say. And also it may depend where you go, because different places have bought in different vaccines. At Croydon, at the hospital, we've been giving the Pfizer vaccine. And also because of the way the Pfizer vaccine has to be stored under strict, cold conditions. So the bigger hubs are more likely to have the Pfizer, and then the smaller ones like the GPs are more likely to have the Oxford one, only because of storage. And also, like, they had to order these vaccines. Which one is coming first? They place their order. So those were the things that were driving it. But all the vaccines are effective in preventing you getting very ill.
Hey, thank you so much, Dr. Mary and Catherine. I have a few questions and comments, as well as appreciations coming in. Thanking you so much, Dr. Catherine and Dr. Mary and Catherine, for the wonderful presentation. I have a question here from Afro, which is, could we have, and this time round I'm going to do 4 questions because we have a few more questions that are coming in. Could we have some updates, advice about new variants that have been identified in the UK? E.g., the South African variant, is there a Uganda variant? Today I heard there's a Russia variant. So whichever variants that have been identified, could we have some more information about them, whether we are at risk? And then there's a question from Joyce, which is, we have people who have taken the vaccine unaware they had the virus and have been affected very badly. What is being done to ensure that people are virus-free before taking the vaccine? Then the third question is, when I receive the vaccine with underlying conditions like cancer, can the vaccine boost my immune system in that regard? So that's question number 3. And question number 4 is going to come from Mr. Mukibi here.
Oh, hello there. I actually had 3 questions.
One at a time.
Okay. You see, there's a lot of reasons why Black people are very worried about the agenda behind this inoculation. Because in 1946, syphilis was introduced in young men in the USA in the name of vaccination. What is Dr. Mary got to say about this? People have read about this and they're very worried because of this, because of what happened in 1946.
Okay, so those are our 4 questions. So if you may take turns, Dr. Mary and Catherine.
Shall I answer the first one about the new variants? We know that the virus, the original virus that started here in March has been overtaken by a new variant called Kent, the Kent variant. Kent variant is now everywhere. The South African variant has been detected in a number of places, and currently, again, Public Health England is doing enhanced surveillance. We are testing a lot more people and looking specifically for the South African variant. One of the reasons we are sort of concerned about these variants is the potential to affect the effectiveness of the vaccine. So we don't want them to spread, and that's why they've put up these new preventative measures. There are other variants like the Brazil variant. We haven't seen it in the UK. And I think there was one which was mentioned as a Japanese one, but we haven't seen that one in the UK. At the moment, it's mainly, the main one is the Kent variant, which is the main variant in UK. The other question was about someone getting the vaccine when they are unaware that they have COVID. Catherine, do you want to answer that?
Sorry. When you come for your vaccine, one of the questions we ask you if you're feeling well, you know, we don't want you to be ill and then have a vaccine, had side effects, and we don't know what's causing the side effects. So we also specifically ask you if you've had COVID in the last, or COVID symptoms in the last week, or if you've had COVID in the last 28 days. Obviously, if you've had no symptoms, if you're feeling well, then we will go ahead and give you the vaccine. But if you come in and say you've had COVID or symptoms in the last week, in the last 2 weeks or 3 weeks, we'll ask you not to have the vaccine and to wait 28 days after you had your COVID positive test. And I think people have asked about that, you know, people may have the virus and have the vaccine and not know. And at the moment, Public Health England has not said we should be testing people before they have the virus. If you have no symptoms, if as far as you know you haven't got COVID, then you will be offered the vaccine.
Can I say something? Can I ask? Because I know 2 people who have had the vaccine and they didn't have any symptoms and they were feeling well. They didn't have any signs that they had the virus, and they ended up in hospital.
Yes.
So
the vaccine does not protect you immediately, and it takes at least 2 weeks to start working. So there is we are in the middle of a very sort of huge number of community cases, COVID cases in the community, and you are going to find some people who will be immunized when they are incubating. When they say someone has been exposed today and they are not going to develop symptoms until maybe 10 days later, but between that period, they may have the vaccine. So it's not the vaccine that is making them ill, it's the virus, and the vaccine doesn't start working immediately. It takes a while before.
Thanks very much, Dr. Mary. Thank you.
Okay.
Okay, I think there was another question, which was about boosting the immunity.
Yes.
Whether it, for a cancer patient or someone else with an underlying condition, it boosts immunity. And also the conspiracy theory from syphilis. Yeah.
I think regarding the cancer patient, so this is an RNA vaccine. So even if someone is immunocompromised, they are okay to get it. And they, in the trials, there were patients who had underlying conditions, and they found that they did develop antibodies. Obviously not as strong as someone who is very, very well, but they do develop antibodies as well. Catherine, do you want to add to that, or?
No, I mean, when we've been vaccinating, there's been very, very few conditions that people have had that have prevented them from getting the vaccine. And the most common one is if people are on blood thinning medication, but even then they have to find out their levels. And if the level is good, you can have the vaccine. So it's been very, very rare for people who've come in with many conditions for them not to be able to have the vaccine. But again, any condition that you have, you can discuss it and you'll be advised. If they're not sure, we call the pharmacist there and then. they do the research, and then, you know, they would advise us.
Okay. So going back to the 1946 syphilis vaccine, which they said was that was that and many other things about women being made infertile and so on and so forth in the past. People doing studies on Black people. For me, what is reassuring is when you see the people who come for the vaccine, they are all types of people. They are all different colors. And for example, Catherine, in your in where you work, there are different color staff who are giving the vaccine. There are different color patients who are coming to get the vaccine, and you are not separating them out. You're not saying this batch is for this group, this batch is for this group. They are just coming in one by one, and it's not pre-sorted. So I don't think this is an experiment on Black people.
Thank you very much, Dr. Mary. I'm going to get the next 4 questions, and I'll read out 3 from the chat room, and then Barbara, you will ask your question because your hand has been up for some time. Right. The next question is, can you throw some light on how likely one who has had the vaccine fell very ill or even die after 3 weeks, which is the recommended time the vaccine produces antibodies? That's Margaret. I'm not sure that question is clear. I may ask you to ask that question, Margaret, if you don't mind. Vincent asked. Okay. Mr. Kasambla asked. Okay, Margaret, yeah, can you ask your question?
Yeah, Margaret Dongo. What I'm asking is that they say after 3 weeks, that's when your body is like able to have the antibodies. So how likely are you to be very ill or even die after that period? Please, Catherine. Thanks.
After that period or within that period? After taking the vaccine?
Yeah, after 3 weeks of receiving the vaccine.
Okay.
That's for Catherine, please.
Okay, that's question 1. Question 2 is for how long is the best vaccine going to be effective? Is it going to be an annual inoculation exercise like a flu jab? So someone should be able to answer that for us. The third question is from Mr. Mutumba. After getting vaccinated, do I still need to be precautious, wearing masks, social distancing, etc.? That's the third question. Now, the fourth question is going to come from Barbara. Barbara, if you're unmuted, please go ahead.
Yeah, hello, Dr. Twagira and Ruth, thank you so much. I have questions, not just a question, but I'll probably just ask one for starters. The vaccine wasn't tested on the pregnant women and is not being offered to them, but many people don't know that they are pregnant. So if somebody comes and probably didn't know that they are maybe pregnant in the first week or 2 weeks, and then they get the vaccine, what's there in place to protect such people? That's one. The second one is about the variances. The doctor said that they are still researching about the variances. So if say probably you've been vaccinated against the original variants that was around, which I guess that the vaccines around were meant based on that one, and now they are still just researching about the new variances. What effectiveness do we have that when you get the vaccine, you will still be protected and protected against the new variances. The third one was, if I don't know if, can I ask later that the next one?
No, ask later, Barbara. That's 5
Yes.
questions already. We're
Okay.
taking 4 at a time.
Yeah, I will
Dr.
ask.
Mary and Catherine, please.
Can I just quickly say about the pregnant women? So one of the questions that we ask when you come in is, are you pregnant or likely to be pregnant? So if the person says, no, they're not likely to be pregnant, or they're not pregnant as far as they know, they have got the vaccine. So far, I've not had any comeback whereby somebody then found out that they were pregnant before. But like we said, having the vaccine being given is another step in a long, on this journey. They're still doing trials. And last week I had a friend of mine who's registered to be in the trial. She's 3 months pregnant and she's volunteered to be in the trial. She's received her vaccine, so she'll be monitored. So we don't know, as far as I know at the moment, what happens, but we are at the beginning of this journey in trying to find a solution. So trials are going to still be, going ahead. I don't know if Dr. Mary wants to add something about.
Yeah, just again, in the green book, which I mentioned, there is a section on that. The advice is, if you find out that you are pregnant after you've got the vaccine, just don't do anything in a hurry. Don't say, oh, my baby is going to be harmed. No, the advice is just follow the normal pregnancy routes, because as we mentioned, these are very simple vaccines. They are RNA with just something extra added. So I think the likelihood of being harmful is extremely low. So you carry on with your pregnancy as normal. Regarding the variants, the new variants and the vaccine, again, the advantage with the RNA vaccines is that they are so quick in adopting what is happening. So if, for example, the South African variant was the one to dominate here, eventually, the vaccine structure, the RNA structure will be changed to match that variant. So because they are RNA vaccines, they can easily change the structure and they can produce more and more vaccines. So we are worried a bit because I think the new variants seem to spread quite quickly, but the technology is so quick and they are very, very quick in trying to match the strains that are circulating. But at the moment, I think the last reports were saying that the current vaccines are still effective against the variants.
Yeah. And then Margaret's question asking us, how likely is one who has had the vaccine to fall ill or even die after 3 weeks, which is when the recommended time vaccines to produce antibodies. Like Dr. Mary said earlier on, you may get your vaccine today, but then you may have contracted the virus yesterday, the day before yesterday, you've got no symptoms, and your symptoms may be coming 5-10 days later. So you may be very ill, because there is that incubation period. So it is likely that I've had my vaccine today, but actually I was already infected beforehand, or I could be infected tomorrow or the day after before my immune body has, mounted up enough antibodies to fight it. So it is likely that you could get the vaccine today and still catch COVID. That's why the recommendation is that even if you've had your vaccine, you still follow all the other guidelines of washing your hands, face mask, keeping distance.
Yeah, but I've been tested 2 days before, 1 day before my vaccine, so I'm negative. So
yeah,
that's
because
why
also I think
it's 3 weeks after I've had the vaccine. That's why I'm asking that.
Okay. I mean, Dr. Mary may say that, because also if I could be tested today, yeah, and I'm negative, because the viral load of the virus in my body is undetectable by that test.
Okay.
So there is that possibility as well, in that you could catch the vaccine today, but today you're not going to have, they won't be able to measure that viral load, especially with the little tests that we do at home, the lateral flow tests. They're good, but depending on how much virus is in your body, it may not be detected straight away or in the initial days when you've just caught the virus. Dr. Mary, I don't know if you want to clarify on that.
Yeah,
But
it's just to say that there is no vaccine which is 100% effective.
Mm.
So you, for example, for the Pfizer, they are saying 95%. So there is that 5% who may not respond. So it's saying for the majority of the people who get the vaccine, it will protect them up a certain level, but 1 or 2 people might pass through and not get protected. That's similar to all vaccines. They are not 100%. But even being 60, even being 50% means 50% of those patients will not get severe disease. And going back to the infection prevention and control measures, the vaccine does not stop you being exposed to the virus. The vaccine prevents you getting severe disease. And so you may still get the infection, but it will not be severe. You are less likely to go to hospital, but you may pass it on. So even if you've got the vaccine at the moment, we don't know how much it prevents people from passing it on. So you need to keep the distance, you need to wear masks, you need to wash your hands. At least for now, we are still observing what this vaccine is going, how much protection is going to give us. So we shouldn't relax. And there was a question about how long the vaccine is going to protect you, whether you're going to get it annually. I think that answer hasn't been made. Catherine?
Well, at the moment, as far as I know, they've not yet told us if we're going to have this annually or not. One of the things, like I said, there are trials now that people are getting the vaccine, a few people have come up and they're testing our blood, they're testing if we've caught COVID to see how long the antibodies are staying in the body for. So at the moment, as far as I know, we don't have that information.
Thank you. And I would also like to add that you've answered that question implicitly before when you say that if there's a variant, it's got to be redone again. The technology is quite fast. So we are still in deep waters. We haven't come out of yet, even though the vaccines are around. Thank you for that.
Okay, thank you. Thank you so much. We have a few more questions. One of them is from me here as I get up the chat room. Mine is, Dr. Mary talked about I think it was Catherine. She said about the side effects, that there is short-term side effects after you have had the vaccine. You may have some pain, but on the social media and going around, there's a lot of questions about long-term effects, some unknown and some that may be known. Is there any information about any long-term side effects? That's question one. Then question two. Question two is from AZB. I don't have the name there, it's in the chat room. Do you think it would be better to take the tests before having the vaccine. And someone also asked whether it would be advisable to take paracetamol before taking the vaccine, so we can put those together. And I must say there is a lot of thanks to you, Dr. Mary and Catherine. And also there is a few people who are saying that they have taken the vaccine. Some took, Mark took it 4 days ago, and I think Agnes took it a week now, and they are all fine. So we have a few people in the community who have taken the vaccine, and thank you so much for those who have come forward to encourage us, so we know that, you know, it can be taken. I also am going to invite a question from Vincent here, and the fourth question from Barbara. Barbara, your fourth question after Vincent.
Hello, I think this will be going to Dr. Mary. When you read about different articles on the internet, they tell us that scientists are at that stage where they have developed substances which can have effects on particular ethnicities. When these substances are subjected to, say, whites, they will have no effect at all. But if they are subjected to a black man, they are going to have an effect. What do you have to say about this? Is this true or false? And the last one is, how many of these viruses are introduced in each jab? Like when you get a jab, how many of the viruses are introduced in your body? Thank you.
Barbara?
Hello, yeah, my question is also to Dr. Mary. It was asked, I think, before. I just wanted to know, like the flu jab, we get it every year, and every year they have to manufacture a different vaccine for the strain that is in the community at the time. So now that we are getting variances before we even finish the first initial one, are they going to be manufacturing vaccine? I mean, yeah, vaccines, and are people going to be getting it on an annual basis? Or is it a once only that you get your 2 vaccines and then you're protected for the 96%? What is the take on that? And I've also heard that people are being given money again, those to go for research, like 4,500 grand. If you come out to go for research, they are still looking for people, that they are still researching about the vaccines. So why are they still researching and, you know, offering people money to go for research when the vaccines are already in use?
Okay. Long-term side effects. First of all, these vaccines have been in use for just a couple of months. So we don't know what the long-term side effects will be. The main reason for bringing these vaccines very, very quickly on board is to really smash this pandemic and put a full stop to how fast it is moving. Otherwise, it's going to be lockdown, lockout. So the side effects haven't yet been published because they've just been in use. But as I mentioned, the Ebola vaccine, which is similar to the AstraZeneca vaccine, has been in use for many years, and they've reported no major side effects as such. Staff and people in Ebola areas have been getting that vaccine without any. It's an RNA vaccine as well. So that's probably the answer I can give. I don't know whether, Catherine, you have any information on long-term side effects?
No, I haven't got any long time. That information, I don't think we have it as yet. Like you said, we've only just started using the vaccine since last year.
Yeah. Then testing before taking a test before you get the vaccine. As Catherine said, Public Health England usually are the ones who sort of, they give the rules on how we manage the patients. And they haven't said that you should be testing before getting the vaccine. And we have to follow what Public Health England is saying. Regarding paracetamol, you can take it afterwards. Why do you take it before? You can take it afterwards. That's fine, absolutely fine. If the arm is painful, it's absolutely fine to take paracetamol. The question about substances that are in the vaccine that may affect Black people more than white people, I think that should have come through during the trials. As Catherine was saying, about 9% of the people who were involved in trials were Black. So that should have come through. So I don't know anything about that. I don't think it is true. And how many? Okay, and the other question was about how many viruses are in that each injection. And as I said, it is part of just a bit, a very small slice of the RNA. On its own, it can't form a virus. So it's not a virus, it's the RNA. It's like their, it's RNA, a very small piece of RNA that is injected, and after it has stimulated the body to form the antibodies, the RNA is destroyed. It doesn't remain in your body.
Dr. Mary, you may have to explain to us what RNA means, lady.
Okay. It's ribonucleic acid. It's part of the genetic code, but for the virus, it's RNA. For us, we have a mixture of RNA and DNA.
Thank you.
Okay.
Was there a question, another question about Barbara's question?
The flu jab having money, there was something about money being offered for research.
Yes.
And as I've said, there's over 100 vaccine candidates that are being studied. So currently with these 3 vaccines that we have, what the government and public health are doing are just monitoring what is happening, side effects, and does anybody get reinfected, and so on and so forth. But for these people who are being given money, that is a new study, a new vaccine is being tested out. So it's not the current vaccine that they are testing.
Right. Thank you, Dr. Mary. I think there was another question here about, is everyone getting the same dose of the vaccine, regardless, yes, I think, of their age, size, and everything?
Yes.
And another question is, many thanks, Dr. Mary and Catherine. If I suffered from COVID last year, does it mean my body built immunity and antibodies? Do I still have to get the vaccine? Right, and I think Margaret asked again about why is COVID affecting Black people more than white people, which is a general question. Does anyone have a fourth question? Or we could just have these ones and end our discussion. Reverend Amos.
Yes, I do have one.
Reverend Amos has a question. Yes.
I was saying, like a Father James, a lot of us, especially us Black clergy, have been encouraged by our diocese to speak to members of our congregations about the need to take the vaccine because of the fears that Dr. Mary Twagira has mentioned. But I've come across a number of actually Ugandans who say they got some concoction is from some Ghanaians somewhere in London, and they are kind of thinking that they are now immune or safe from the vaccine. What do you think about these remedies we hear about from London, from the Black community?
Okay. I'll go to the first question about Black people being affected more severely than white people. I think that is being observed in the West. And there are many factors, I think, that are contributing to this. I think we have more underlying comorbidities like diabetes, asthma, and because of those underlying comorbidities, those are make the disease more severe. There might be some genetic element, but it's not, that hasn't been proven yet. The vitamin D, lack of vitamin D was mentioned, and again, that is still under review. So there may be many factors that make the Black and Asian people more susceptible to severe disease. And I think, especially here, I think being Black, being certain age, the risk factors sort of multiply. So that's why I think we should be very, very try and get the vaccine, at least to try and reduce the severity of infection. Once you have the infection, someone wrote about having COVID last year and whether they are immune. The immunity to infection appears to last about 3 to 6 months, and then it wanes. So that's why they're saying even if you've had the infection, it's better to get immunized because the immunity from the vaccine will last longer. The concoctions, I really don't know whether they work or not, and without having done any studies, I can't say any particular concoction works or not. We, in the first wave in the hospital, we were really helpless. We didn't have much to use to treat the patients. But there are studies that were ongoing very, very, very quickly, which have informed us. And fortunately, for the second wave, we haven't lost as many patients as we lost in the first wave because of evidence-based medication like dexamethasone coming on board with evidence. So these concoctions, I don't know if someone has studied them or not, but I wouldn't say that they would be my first choice to go to. Catherine, do you want to add anything?
I just wanted to, somebody asked about the dose that everyone gets. Yes, it's the same dose that everyone gets. And also with the concoctions as well, as Dr. Mary has said, there is no scientific evidence, but boosting your immune system, looking after yourself, eating well, exercising, that is good for your general health, not just for COVID. That is good for your own health, eating well as well. So, looking into your diet. And Dr. Mary has mentioned comorbidities that sometimes, the Black community we have, like diabetes, high blood pressure, and that is very much related to our lifestyles as well. So yes, improving your general health will help your whole immune system. But so far, it's not shown to be protecting you against COVID. At the moment, the best option that we have, is the vaccine. And also somebody mentioned, how come more Black people are dying of it? Studies are still ongoing, and the things Dr. Mary has said as well apply. But also one of the studies that came out is that there are more Black people who are frontline, so we're more exposed to catching it. So that's why I said at the beginning, you have to really consider your own personal situation as well. Don't just listen to other people telling you don't take the vaccine. They may be telling you don't take the vaccine. They're working from home. They're home by themselves. So their chances of being exposed are very few, but you are working on the front line, wherever that is. That means you're more exposed. You may have other health issues as well. So that also puts you more at risk than other people. But also we've seen younger people who supposedly are very healthy, who have caught the disease. Some have been okay, but some have been very ill and ended up in intensive care. And we have lost some as well. So do not just take what other people are saying without looking at your own situation and making a very informed choice of whether you take the vaccine or not.
Thank you so much, Dr. Mary and Catherine. I think you can see how people have been thirsty for this information. I don't think we can have an end to it, but I'm just gonna now ask everyone to realize we have to end at some point. I'm going to take the last 4 questions. I have 2 questions on the chat room, and if there's 2 other questions anyone wants to put up their hand and ask, this is the time to do so. After these 4 questions, we'll be wrapping up and appreciating our presenters. So the 2 questions in the chat room, one is whether you have collected enough data from the vaccinations that have taken place, and if so, what data you have collected. And then also, if someone is traveling to another country and is required to prove they've had the vaccine, how do they prove they've been vaccinated? Anyone with a question? Barbara, you had a question? So we're taking two more questions and closing. Right. Okay, just question coming now. How can people who are underground access the vaccine? And in underground, meaning people who are undocumented, if you have that answer for us. Right. I think if there's no other questions from the congregation, then let's have those 3 answers and we can close.
Okay, how much data is being collected? When you come in, it's the questionnaire is just a one-sided questionnaire. You know, your name, your address, your NHS number if you've got one. If you haven't got one, we can always find it. Allergies, whether you're pregnant or not. So that all is just helping them to build a picture as well. We do not analyze the data. The data, that sort of information goes to Public Health England, and also your ethnicity we collect. And it's from that sort of data that they're seeing that less Black people and Asian people are getting the vaccine. So that's the sort of, they'll be using the data for different things, but it's a very simple form. And if people cannot complete the form, we will help you complete the form. About people being underground, so far the government advice is still go ahead for the vaccine, either through your GP, through your work, or if you've been invited to get it, take whatever you have to get the vaccine. That should not put you off. That if you're underground, we're not asking you about your immigration status or anything like that. Was there another question, Janet?
About travel.
Yes, about travel. How do I prove I've been vaccinated?
When you've been vaccinated, we'll give you a card. So the first time you come, we'll write the vaccine you've had, the date, and the batch number of the vaccine. And we'll ask you to bring that card back when you come for your second vaccine. And that's the card that you have. At the moment, I don't know if other countries are accepting that as proof. I don't know about that.
Okay. I guess that's all the questions that we had. I want to just add quickly to the answer for the people who are underground. I know for sure this has been circulating in our circles, in the legal circles, that undocumented people are free to take the vaccine. There will not be any repercussions, even if you don't have a GP, go to a center where you can take the vaccine when the time comes for your age group, or if you are people are invited along. You won't have any problems taking the vaccine. There is an amnesty, so to say.
Is there a chip in the vaccine?
No.
No.
Showing you. I was just showing you what you get when you've got the vaccine. You have something like this.
Okay. Right. So I think it's time for us to close now. Mr. Mutumba, all the way from Dubai, we want someone who can give us a vote of thanks to our presenters this evening. Mr. Mutumba, we want to move a vote of thanks to Dr. Mary and Catherine for the wonderful work they've done in our community this evening, and for the rich information they've provided. For myself, on my behalf, I want to thank you, Catherine, for just making my work so easy to coordinate this, and Dr. Mary for agreeing so easily to come along and give us your time. But I'll ask Mr. Mutumba to thank you officially.
Dear Catherine and Mary, we want to thank you on behalf of the community of Ugandans in South London and all over London itself, because I've seen people all the way from Manchester as well. Thank you very much for the information, the wonderful information you've given to us. We want to wish you all the best, and we wish you could come back and maybe give us more information, or even join our congregation. You see, we are lovely people down here, and you are most welcome to join us, please. We happen to pray the last 2 Sundays every month, and you can stay in your home, in your comfort of your living room, and you join us for service. But anyway, thank you very much for all you've done for us. God bless. Thank you.
Thank you so much, and can everybody unmute and give a big clap?
Thanks.
Thank you.
Dr.
Thank
Mary
you.
Catherine. We really truly appreciate, and I think from this we're going to have. I think we are ready for the vaccine, aren't we, everyone? For those, yeah, I can see so many thumbs up. So this information has been really good. So personally, I am. So we shall look into more information, and going ahead, we shall encourage other members of the congregation. If we need more information, we ask that you will be kind to answer our queries when we pass them over to you. But lastly, I would request if Dr. Mary can share the slides with us. Is that okay, Dr. Mary?
Yes, of course.
Thank you so much. Thank you so much. So everyone, if you want that information, it will be available with the church to share from Dr. Mary's slides. We are so grateful. Thank you so much.
Janet, just a quick one for Dr. Mary. Catherine said she's had the vaccine. Has Dr. Mary had the vaccine? Just for encouragement to the community, because we...
Yes. Look, I've had the vaccine.
Thank you, doctor. Thank you.
Thank
I
you.
didn't have any side effects actually. Even the pain, I didn't get any pain.
I think we've had about 5-6 people in the chat room who have had the vaccine as well, and hardly any side effects, just a day's headache here and there. So, yeah. Thank you so much.
Hello, Janet. Robin
Hello.
Ababini.
Hello,
Robin,
Janet.
can I speak?
Guys,
Mrs. Machiwi.
we are closing. Do you?
No, I'm not speaking. I just want to say I
Yes.
had my vaccination yesterday, but the
Oh,
best
wow.
thing,
Yes.
I got is a sticker after the injection.
So
So
you had
encourage
a
people.
smiley face.
Eh?
A smiley face sticker.
Yes. So
For
everybody
being a
should.
good girl.
I know because I
Well
don't like
done.
needles, so I got a
Well
sticker.
done.
Okay.
Well done.
Okay.
as
Thank
we
you.
close-
Get a street.
As we close, if I let you know, members, we have a talk next week about the effect of COVID-19 on parents. Over the time we've been homeschooling and all of that information about how parents have coped under the lockdown and COVID-19. So there is a talk from a social worker and a very informed member of the community. So please join us for the service next week, which will be led by Team Marco, the one and only Team Mark.
Are they
Thank
only
you so
looking?
much, everyone.
Are they
And
only looking
tonight,
at the effects of COVID on the parents, not the children?
the impact on families.
The
So
community.
community, families, everything.
Janet,